Hello, I'm Dr. David Roberts from Manchester West Vet Hospital here in Ellisville, Missouri. Want to follow through with our allergy problems. We've talked about skin problems, and I want to focus on ears in this particular episode. What we find with ears, and this is from everybody, this is board-certified veterinary dermatologists. These people study these patients, and what they have told us in the literature, in the articles, is that allergies are the #1 reason for ear problems. Everyone thinks of, well, I got a Cocker Spaniel, I've got a Labrador Retriever, it's got floppy ears. They have ear problems because of their conformation. Some of that is true, but a lot of it is that because they do have allergies. When we see a young dog with ear problems that are chronic, we almost have to suspect that it is a food allergy. And when we start thinking about food allergies, we start talking about, as we've spoken in the last episodes, is foods that are made from what we call hydrolyzed ingredients, where they take an ingredient and they break it up into small pieces. Or we talk about foods that are made from novel ingredients, such as this food, which is made from fish and potato. And they make foods that are made from kangaroo and potato and kangaroo and oats, and there's a lot of different products out there, but those are important. When I look at a patient, and we'll kind of look at Cruiser here, we'll look at his ears. We'll take our otoscope and we'll look inside of those ears, and we'll see if they're red, inflamed, waxy, irritated. His actually look really pretty good today. It's also tickly when I do this to any patient, so they always kind of move away. But Cruiser did pretty good there. His ears look fine, but we see some dogs that come in that have significant ear changes, and inflammation and wax and odor and irritation, and they're itching, and they can even get to a point where that ear canal is starting to get closed down. There's many different things that we can do with the ears. One is ear cleaning. This is one of the many ear cleaners out there. It doesn't matter so much what ear cleaner you use, just want to make sure that you use it. The way that we use it is we basically, this is a model of an ear. This shows the dog's ear flap, shows the canal, that's the eardrum. If I put this product in there, it's going to run down to the eardrum, won't go any further. I'll go ahead and push and prod on this. You'll hear a squishy sound, and then we let the dog go ahead and shake it out. Then we'll come back with paper towel, with cotton, with any Q-tip perhaps. If there's a lot of wax in the crevices here, we'll go ahead and clean that ear out. But ear cleaning is not the whole story. Once a dog gets an ear infection, a lot of times they have a secondary infection with a yeast, and yeast are everywhere. They're in the yard, they're in the room, they're in your house. It's ubiquitous, it's everywhere. So what we actually have to do is then come in with a medication to actually treat that ear problem and get rid of the yeast and kill the bacteria that might be hanging around in there, and also to make sure that we've got the that we've killed all the critters, if you will, but we also want to make sure that we're decreasing the inflammation to that ear. But when we look at ear problems, it's important to remember that a lot of times it's related to a underlying cause. It could be the inhaled allergen, as we talked about in the last episode. It could be the food allergen, as we've spoken about. It can be, bottom line, those things are causing it. So when we look at skin, we often think it's an allergy. And remember, that ear canal is lined with skin. That's what it does. So what we tell folks is that look for the bottom line, try to solve that problem, and I think that you'll have a much better problem as opposed to just using medications and medications. So remember, the ear is probably the most common area for us as veterinarians to see allergic problems, and that's where we try to come in with food changes, dietary changes. We come in with the ear cleaning, and even sometimes the blood test for inhaled allergens such as your molds, pollens, dust mites, and that type of thing. I'm Dr. David Roberts from Manchester West Veterinary Hospital, and I thank you for your time.